Thank you, Mr. Chairman, for yielding to me, and I think the discussion that we're having underscores the very value of Mr. Pallone's amendment. We're anticipating what it would mean to have millions of children pushed into the ranks of the uninsured at some level and in some way, and I think it's important to remind us that the federal poverty level line is drawn at $22,000 of income per year for a family of 4. That's for all of their needs, all of their health care, daycare, new clothes and whatever, food on the table. And in the light of the bipartisan efforts that we've had in the Congress in the past to recognize that despite our differences in opinion on so many things, investing in children's health care is worthwhile. That's the underlying of SCHIP. The return on investment is also still the case, which Mr. Pallone said. Children continue to be a very affordable group to cover. They represent over half of Medicaid enrollees. They still account for only 1/5 of the program's cost, 1/5. And we've been successful. Between CHIP, Medicaid, and employer-provided health care, nearly 90% of all children now have health insurance, setting them up for healthier, more productive lives and reducing the uncompensated care burden on our economy. Yet all of this would be jeopardized with the possibility of this legislation becoming law. In California alone, it's estimated that the repeal of the MOE will place 400,000 children at risk of losing coverage. Nationally, it could affect nearly 14 million children. This doesn't make sense. When children are uninsured, has already been said this as well, they are likely to lack immunizations, needed prescription medication, asthma care, basic dental care. Not surprisingly, they're likely to miss school due to health problems, experience preventable hospitalization. This has a huge economic impact on families as parents have to choose between their job and caring for a sick kid on $22,000 a year. You don't have a lot of access to daycare. As a school nurse, I can tell you that it leaves these kids very far behind in school. If her ears ache, a young kid doesn't hear well, their ears are ringing, they have trouble breathing because his parents could no longer afford an inhaler. We know how hard it is to catch up once you get behind in school. This amendment simply ensures that if this bill is enacted, we don't go back and lose the ground that we have fought on a bipartisan basis to achieve this. I'm seeing what my governor and our legislature is doing in California, a state hard hit with its economy, making drastic cuts in programs that we all believe in because they have to balance their budget. This is what we will burden the states with. And what they'll do is pass this burden along. They have to balance their budgets so that the burden will be passed onto local jurisdictions, onto county health departments, onto hospitals who will continue to provide the care, more and more of it uncompensated. Providers will see these kids. You know they will. Who's going to compensate them for their care? We're just passing the buck of our responsibility here on to most particularly vulnerable children, and that's why I support this amendment.